Good afternoon. Hi, Roger. Hi, Stephanie. Lovely to have you here with us this afternoon. We're just going to let a few people continue to come into the room just before we make a start with this afternoon's webinar. We've got just a few more guests joining us, an opportunity to make yourselves comfortable and settle in as we're going to be together here over the next hour. So a lovely warm welcome, everybody. My name is Gracie Tredgett, and I'm the current project manager for the Integrating Our Mental and Physical Healthcare Systems project. It's really a pleasure to be here with you this afternoon in what is in fact our third webinar in a series of 6 that we've been delivering as a team over the last couple of weeks. For those that may not know very much about who we are and what we do, the IMPHS project has been delivered over the last 3 years, and it's an opportunity for us to think a little bit more about physical health interventions that could support adults living with SMI. What we've been doing over the last few years is focusing on different areas of interest, and through this webinar series what we're hoping to do is share with you in a little bit more detail about each of the areas of focus, what we've learned and some of the outcomes of that work. Our hope really is so that you can hear a bit more about it, and we hope very much to be able to transfer some of that learning and thinking into the work that you do. This webinar over the next hour is going to involve a few different things. So I'll be pleased to introduce a few different colleagues that have worked with us on the digital devices study, which is of course the focus of today's webinar. And what we aim to do as well is invite colleagues that have worked with us, including our experts by experience, who have been fundamental in helping us shape the delivery of this particular project. The overall approach of today is really to share what we've learned with you, but we want it to be as interactive as possible. So I really invite you to share your thoughts and questions and reflections in the chat with us. There will also be opportunity at the end, of course, for a Q&A with the key members of today's webinar. So if there is any burning question that you do have that you'd love to ask us, we really invite you to add that to the chat. So at this point, all that there is for me to say is just a huge thank you for joining us this afternoon. And I'm really thrilled now to be handing over to our first speaker, who's going to give a bit more of a background on the introduction to this particular study. Zani, I will hand over to you. Thank you so much.
Thank you, Gracie. Good afternoon, everyone. So I've been, shall I wait for you to, that's it, brilliant. I've been involved in this project since the bid application stage, so quite a few years ago now, when I worked at the Centre for Implementation Science. But then shortly after we submitted the ethics application, I went on maternity leave. So it's a real pleasure to come back and to be here to talk to you about the study today. So what do we mean by digital health interventions? For the purpose, so yeah, sorry, still on this slide. The first, that's it, brilliant. For the purpose of this study, we define digital health interventions as digital technologies that can be used to improve health behaviours, so such as smoking, alcohol consumption, physical activity, or can be used to support an existing health condition such as heart disease, diabetes. So examples of digital technologies include things like smartphones, smartphone apps, wearable devices, websites, patient portals. There's quite a lot of variability there. Next slide, please. So the use of technology digital technology for managing health conditions and behaviours isn't new. Computerized CBT, as you'll all know, has been around for a long time. So for the treatment of depression and anxiety, the NICE guidance came out 20 years ago now, and computerized CBT is delivered routinely within the IMPHS step care pathway. So the physical health field was soon to follow, with websites based on the principles of CBT, motivational interviewing for behaviours, again, like smoking cessation, alcohol consumption, among others. So I actually work in the alcohol field. And what we found after building a huge CBT-based website back in 2006 to 2009 was that people wanted something much briefer. So there was a move toward a smaller number of behaviour change techniques, so such as personalised feedback, self-monitoring, goal setting, which lent itself really nicely to apps So here are a few examples of apps for reducing drinking, for quitting smoking, and these particular ones were developed by Public Health England. So as everyone knows, technology moves very quickly. So by the time academics had finished evaluating the effectiveness of smartphone apps, people were then using wearables. So anyway, there is an evidence base to support the use of websites, the use of apps that promote health behaviours, specifically those digital health interventions that use psychological principles of what works in practice. But this evidence base is in the general population, and what little has been conducted in people with mental health conditions focuses on common mental health conditions. Next slide, please. So the aim of this study was to evaluate the acceptability of DHIs, that stands for digital health interventions, to explore barriers and facilitators to use and any perceived impact on physical health. And this is among people with severe mental illness. So we used a mixed methods approach. The stage 1 used an online survey to capture the breadth of people's experiences. Stage 2 used semi-structured interviews, and this was to explore people's experiences in a bit more depth. And stage 3 used a series of workshops for a range of stakeholder views, so to capture a wider perspective. So Kathy will talk about the methods in a bit more detail, but I've just outlined them here before I go on to introduce our theoretical models that we used. So we used 2 theoretical models to guide the data collected in our survey and in our interviews. Next slide, please. So for the survey, we wanted to explore the acceptability of digital health interventions currently used by service users for supporting their physical health. So we started by looking for an existing validated survey for acceptability of digital interventions. So the Centre for Implementation Science, I'm not sure you can actually see it on this slide, but I put a little URL to a repository of validated implementation outcome measures. So for anybody that's interested in that, please feel free to contact me and I can send that to you. So we chose a survey based on the perceived attributes of e-health innovations theory. So this is an extension of the diffusion of innovations theory, which you might have come across. It's a very an old one, a popular one. So this theory is thought to explain and predict the adoption of an innovation, and includes 5 different constructs, of which we included 4 within the questions of our survey. So we had questions on the complexity of the intervention. So is it simple to use or much more difficult? Questions around compatibility. So does the intervention fit with your routine? We considered relative advantage. So does the digital intervention have an advantage over your existing care? And observability. So do other people's opinions of the digital intervention have an impact on your use of it? So we had several meetings with our experts by experience to examine the wording of these questions, checking that it made sense and was relevant to the study, and we're very lucky to have them here today to tell you what they thought about this process. The next slide, please. So for the interviews, we selected a different framework. So we wanted to delve deeper into the experiences of people using digital health interventions. So we selected the e-health literacy framework, which provides a framework for exploring the individual's ability to understand, use, and benefit from digital health interventions. So it includes 7 different domains, which you can see numbered on this slide. And they explore e-health literacy from the perspective of the individual, the system, and the interaction between the two. So we use semi-structured interviews So whilst we prompted participants to consider their experience using the different domains of this framework, the interviews were fluid enough to allow the participants to talk about what they felt was important to them. Right, so I'm going to pass you over to Kathy now to expand on the methods and present the findings. Thank you.
Good afternoon, everyone. Thank you, Zorni, for explaining a bit about the background of the study. I am Kathy, I'm the research assistant on the project, and I'm going to explain just a wee bit more about the methods and then go into our results. So next slide, please. So the methodology. So what we did was we wanted to take a mixed methods approach, and our study consisted of 3 very distinct stages. So as Zorni mentioned, stage 1 was an online survey, and that solely involved South London and Maudsley service users with a diagnosis of severe mental illness. And then from the participants that took part in stage 1, 15 were invited to take part in stage 2, which was the interviews. And again, that was just with our SLAM service users. And in the final stage, we held stakeholder workshops. And the interesting part about this stage is that we wanted to expand our cohort to involve service users, SLAM clinical staff, carers, voluntary sector staff members, and commissioners. And what we did in this workshop is we brought all of these people from across the board together, and we presented the results from stages 1 and 2 of the study. And we asked the stakeholders involved to sort of discuss these results and help us interpret them in order to come up with a set of recommendations for digital devices, which we will go into a little bit later. And just to again mention that our study was co-designed by 2 experts by experience, which we will have the pleasure of chatting to just a bit later about their involvement in the study. Next slide, please, Gracie. So stage 1 results, the online survey. So we had 33 participants take part overall, and there was a huge set of results from this survey, so I'll just sort of go into the main ones. But over 54 different digital devices were named in the survey, and these are the big 3 that were mentioned were Fitbit, MyFitnessPal, and Apple Health, which maybe some of you have heard of. But the most common target behaviours were exercise, diet, and weight management. However, people really use digital devices for all sorts of things. So aside from these 3, there were a lot of devices aimed at stopping smoking, period tracking, sleep monitoring, and really just expanded across such a broad range of behaviours. And so in our survey, one of the big parts was to rate experience of using digital devices. So there was a number of statements which were Likert style items. And generally, when we looked at those results, we found that the participants were generally satisfied with their preferred device. So Gracie, if you could switch to the next slide, please. We can see the different Likert items here. And if you look at the graph, you can see that for each and every item, over 50% of participants either completely agreed with the statement or slightly agreed. And all of these statements, if you're able to see them there, I'm not sure if they're a bit small, they're all sort of positively skewed. So it really just went to show that people were very much engaged with the digital devices and they did enjoy using them. So on to the next slide, please, Gracie. So then on to our results from the stage 2 interviews. So again, there was a really broad range of results from this. We had 15 different interviews. Myself and one of my colleagues conducted the interviews, and honestly, just every single one was so different and so rich in information that it was quite hard to whittle down to one set of results, but we've got sort of a very brief summary here. So generally, participants preferred devices which were simplistic and also passive. And what I mean by passive is people preferred devices that sort of functioned in the background while people went about their day. So for example, a big one would be step counters or pedometers that were just on people's phone. There was no need to sort of activate the device. They just sort of went without any real sort of engagement. And also people preferred devices which incorporated data syncing and allowed people to share the data. So whether that was with friends, family, or even clinical staff, people really appreciated having that option. And on the flip side of that, some of the negative qualities which people noted were intrusiveness. So for example, some devices might ask quite a lot of personal questions in order to use the device, and people didn't really rate this. And also people felt across the devices that were already out there on the market, there was a lack of consideration for any diagnoses. And on top of that, there were a lot of benefits reported to using digital health interventions. So participants found that they felt an increased sense of autonomy in their own care. They felt the devices were very encouraging. They helped set positive routines, and also people saw some really tangible improvements to their physical health, which is great. So that was mainly things such as weight loss or increased physical fitness. But again, on the flip side of this, some participants did note that the digital interventions could hold negative impact. So for example, there was occasions where there was encouragement of toxic behaviours, and this was mainly linked to things such as over-exercising or calorie counting. And also people noted that there was the potential for the interventions to be quite demotivating, so slightly counterintuitive in that sense. And one example of this is which quite a few people noted was that once maybe that positive routine of using the device was broken, they found it twice as hard to get back into that routine. So it really had the potential to be counterintuitive as well. And just across the board, really, there was a really strong appreciation of the very complex link between mental and physical health. So level of device usage and motivation to engage with digital interventions could be directly affected by mental health and fluctuations in mental health. So for example, if people per se were feeling a bit lower, they wouldn't necessarily want to use their device, and they could find that, again, it could be counterproductive in terms of their mood. And again, I've just added on to that they had the potential to impact mental health positively and negatively, which should be taken into consideration both prior to and during usage. And finally, one of our main takeaways was that devices were seen as a very positive aid to clinical care, but could not replace it. So people valued devices as an accessory, which helped self-manage of their own health without having to constantly go back to their care team for more information or attend excess appointments. But there was a real emphasis put on the fact that it should not be a replacement for clinical care by any means. Gracie, if you can move to the next slide. And at this point, I just wanted to share a couple of quotes from our interviews. And again, there was many quotes I could have used, but I think we only have time for a couple. So I felt that these three sort of summed up the sort of sentiment of using the devices quite nicely. So our first one, the participant commented that he thinks that's what it's all about. It's saying that you've achieved something, no matter what it is, you've done something. And our second participant, Julia, said, I love monitoring myself. I feel good when I'm doing it, but I feel like I've got some control, and I feel like I can see where problems are starting to come up or what I've done in the past where I could actually do better. And finally, we had Carl, who reflected on being able to share the data from his devices with his care team. So he reflected that he'd been psychotic and hospitalized, and he was recovering, and it gone from zero, and then he had to reinvent his life again and focus on all sorts of things, so social stuff, voluntary work. And he said when he could quantify things and share that information with services, it helped him say, I'm on track and I'm seriously trying to keep abreast of where I am with this. And that brings us on to the results of stage 3, which was our stakeholder workshops. So we had 14 people take part across 2 stakeholder workshops. So we held one of these in person and we held one of these online, just to give people the option for what sort of suited them best and what made people most comfortable. So again, across those 2 workshops, we had a real mix of service users, carers, clinical staff, commissioners, and local voluntary staff. So the main sort of takeaways we got from the stakeholder workshops, and just to say, we came up with a full list of recommendations which will be available shortly, but just to cover the real key points that came out of these, was that participants were interested in clinical guidance of what devices were out there that they could be using to manage physical health. And they also noted that in the future, it would be good to have clinically approved devices. So devices that maybe took note of research or were trialed in real world context. Again, it was noted that devices should be an accessory, but not essential to care. And this was really to avoid contributing to the issue of digital exclusion. So making sure that people who maybe don't have access to digital tech are not losing out in the sense of care. So service users, carers and clinicians all agreed that they could benefit from further training or information about devices. And one of our suggestions for this was a popular devices list, which we are hoping to produce from the study, and also the suggestion of peer support networks. So whether that was getting service users together to help navigate through using digital technologies, or again, a lot of clinical staff said they didn't feel they had the confidence or the knowledge to recommend devices to service users, so they would really appreciate some sort of training network with this as well, just to sort of empower and engage the clinical staff too. But again, it was acknowledged that there was a need for research on a much greater scale, as our sample size is quite small. It was also noted that in further research, it might be an idea to focus on certain demographic factors. So whether that be use of technology in different age groups or link to illness acuity as well. So just want to summarise quickly sort of what this means and what has come out of this study. So we've managed to add to a gap in research by gaining an understanding of the use of digital health interventions for physical health by people with severe mental illness. Our sample successfully represented a mixture of ages, genders and ethnicities. And we've just managed to conclude that there is a real appetite for information about digital health interventions by a range of stakeholders, and they could be a realistic and scalable addition to help expand the impact of in-clinic sessions, as it is something that's already widely available. Service users were also very interested in knowing more about what devices are out there, and perhaps devices which were developed with consideration to their specific needs, priorities and preferences in mind. And just finally, before we talk to our experts by experience, I wanted to touch briefly on the outputs of our study. So far, we've been lucky enough to present the study at the MQ Mental Health Festival, and that actually involved, which is a first for me and a first for everyone, I think, a poster presentation in the form of a TikTok video. I don't know how many people are familiar with TikTok, but that was an interesting one. And then also the University of Limerick HIST conference and the MindTech 2022 symposium, and also our webinar series, which is obviously happening as we speak. But apart from this, our main outputs will be an academic paper, an infographic, a popular devices list, and a lay summary. So we will now move on to hear from our wonderful experts by experience. So Lana and Catherine, if you could please turn your cameras on and we will get started.
It says, cannot start your video because the host has stopped it.
Oh, Gracie, are you able to do anything about, oh,
That's it, I'm here.
you know,
That's
Catherine.
okay, Catherine, there we go, yeah.
So thank you, Lana and Catherine, for agreeing to come along and chat to everyone today. It is very lovely to have you here. So we'll just get started with a couple of questions. And again, if anyone who's watching has any questions for Lana and Catherine after, please feel free to put in the chat or just wait until the Q&A session just a bit later. But we will get started. So first up, just wanted to ask, how did you both initially get involved in the IMPHS project? And Lana, we'll come to you first for this one, and then we'll go to Catherine after, if that's okay.
Okay. Afternoon, everyone. I actually got involved via the King's involvement team. I was offered the opportunity to participate in the project, and I accepted. Thank you.
And I got recruited from another service user group I was taking part in at the BRC. So I was recruited from another group.
Thank you both. And during your involvement in the digital study, how exactly have you both been involved and what have you done as part of the project? So this time, Catherine, we'll come to you first and then we'll do Lana after.
Okay, thank you. Myself and Lana have been involved in every aspect of the research, including the ethics committee and the service users survey questionnaire preparation, making sure questions made sense and wording was suitable for the lay summary. We took part in the data analysis after the service user interviews were complete, and the survey questionnaire, making sure the questions were easy to understand and ask the questions necessary for digital, mental and physical health and apps. We enjoyed this involvement very much and learnt a lot.
Yes, we also contributed to the writing of the protocol. We read related documentation. We refined initial survey questions. We made sure the questions made sense. We ensured the flow of the questions was correct. We also monitored the suitable wording for lay audience. We removed the acronyms, which are very widely used. We carried out the data analysis, the interview practice run with the research team, and we also managed the timings. We also made sure that we allowed the service users, whilst being interviewed, to express themselves as little or as much as they felt comfortable to share. And as a main point, we did attend the ethics committee and answered any relevant questions which were posed to us.
And it's surprising how difficult it is to write questions for a survey, because it took quite a while to organise that, didn't it? Surprising how you have to think about the question and the target audience and what you need to find out. And yeah, it took quite a while to develop it, didn't it, Lana?
Yes, definitely.
Yeah, absolutely. And it's, as you both mentioned as well, it's really important to be sort of spot on with that wording. And a big one, make sure not to be using acronyms. And I'm sorry if any acronyms have come up while I'm speaking there, because I'm now just reflecting on that. But thank you both. So you've both been a huge and integral part to really the whole study. So just reflecting on your involvement with the digital study, what has stood out most to you, or do you have any personal highlights at all? So again, Lana, we'll come to you first.
Okay, thank you. I actually found it extremely beneficial to be involved from the grassroots involvement, contributing throughout, learning about all the different devices and apps people are using for numerous and different reasons. I found that extremely beneficial and helpful moving forward. Thank you.
And I found learning about physical and mental health connections and developing a questionnaire that incorporated finding out about the apps they were using for physical and mental health. I think that was really interesting. So many apps out there. Yeah.
Yes, huge amount of apps out there. Even I didn't know the half of them existed, so it's absolutely opened my eyes as well. And just on that note, I wanted to ask, can either of you tell us a little bit about any experience you might have with using digital devices at all?
Yes, I'll I'll take. I have a Fitbit, and this project has ensured that I engage more with it, not only monitoring my steps per day, but also to look at the email weekly report to see changes at a glance and more detail on the dashboard to go into greater detail in order to learn more and hopefully progress in using my device a bit more efficiently and effectively, which does help me.
Excellent, thank you. And what about yourself, Catherine?
I've got a smartphone, but it doesn't allow me to have apps because it's licensed from a peer support office that I work for. So I haven't actually explored the apps, but I've been fascinated to find out what apps are out there and how they've helped individuals with their recovery. If I find someone with a smartphone that I can look at apps, then I will look for some of those apps that were included in the presentation.
Yeah.
Excellent. And then we want to give you the opportunity now to share anything else you would like to say about working with us on the digital study. So Catherine, we'll come to you first this time.
Okay, so it's been great to work with the professionals on this study who've guided us, but they've also given us a lot of leeway to do what we want. So that's been quite gratifying. I think it's early stages of mental and physical health research with apps. It would be good if the apps were regulated so the doctors could recommend the best apps for service users for different conditions. And I think the digital revolution has only just started. You know, apps are just so big now. Everybody's using them. But it would be great to have them regulated so that they had concrete conclusions on what were the best.
Absolutely, Catherine, and I think that was a shared sentiment across our interviews and the workshops as well.
Mm.
And we'll pass over to you now, Lana.
Yes, I echo what Catherine has said and really appreciate the opportunity that we had with the research team and, you know, the guidance and everything that was posed to us was really well thought out, and I'm very much appreciative.
And we did it all online because we were in lockdown. So we've been doing it for about 1.5 years, 2 years now, is it?
Yes.
Yeah. So we did it all in lockdown on the computer when it was all new. So we were learning about the computer and we were learning about the study at the same time.
Yeah.
Seems to go hand in hand quite nicely, doesn't it?
Yeah, it does.
But yes,
I don't think anything but a pandemic would have got Teams and Zoom into our house so quickly. Nothing else would have been able to do that.
absolutely. It was sort of within a couple of days, everyone was on it.
Yeah.
But no, thank you both very much for answering those questions. And again, just to thank you both so much for your involvement. It's been an absolute pleasure and we could not have done most of the stages without you. So thanks again. And I will again pass over to Gracie.
Thank you so much, Kathy, and thank you, Lana, Catherine. It really is such a pleasure, I think, to hear directly from you both about the experiences you've had, because within the IMPHS team, having expert by experience involvement for us is so vital. You know, we come at it as clinicians, academics, as project managers, but I think actually we've been able to achieve some really important work by working so closely with experts by experience. You know, with your expertise as service users, as carers, you see firsthand the challenges, and we want to be able to make the outputs of this work meaningful and relevant, not only for audiences now, but also for service users and carers of the future. And so it makes such a difference having your input. At this stage of the webinar, though, what I would like to do is open up the forum for a Q&A, and I'll invite back onto screen, if I can, Zani, Lana and Catherine, just as, of course, you've presented here with us this afternoon. And I'd like to kind of invite our audience really to just think about anything we've covered in today's webinar, and if there's anything particular that you would like to ask myself or anybody else who's been a part of this session this afternoon. And a few key things perhaps to reflect on. The first within this study, of course, is that we're looking really at the use of technology and how that can really support people living with severe mental illness. And Catherine, you said it quite rightly at the end there. We know we have a long way to go to really understand the use and the effectiveness and actually how helpful it can be, not only in the short term, but for long-term recovery. And I think we're interested in, as a team, to think about how do we go beyond what we've done here in this study? How do we make what we've done and how the things that we've found useful? Of course, our work is sort of centred within South London and Maudsley NHS Foundation Trust, but actually we think the findings have generalisability beyond this trust, of course, because we know there is others that are thinking similarly about the use of technology. So I'm really keen to kind of invite questions from the audience. You can put them in the chat, of course, or you can raise your hand, either way, whichever is comfortable. And while I'm allowing people some time to do that, I have perhaps some kind of pre-questions that maybe we can cover together. Some of the things that were discussed, I think, that may be useful to come back to. I'm really struck, Zani, from your first presentation, just largely about the importance of having a framework to inform this study, and actually the extent to which that really informed the design. From your perspective, how easy was that to achieve, to decide on which frameworks, and actually how did you decide in the end which ones you went with, and what's your kind of feeling on reflection, kind of coming to the end of this work on the use of them?
That's a really good question. And you're going to have to take me back a couple of years to actually have those conversations. I think it was actually 2020. It was like right bang in the middle of the pandemic when we were doing all this design work. I think so. Starting with the survey, we were just interested broadly in people's experiences. In there, we wanted to capture what people were using. We weren't interested in any one particular device. We just wanted to, because we realised from a sort of scope of the literature that there was very little research in this area. So we were really starting from scratch. And I just want to acknowledge that there's a few of my colleagues, Ellie and Ray, who are on this webinar, who know exactly the process, that they were very much involved in it all. So in the end we just started from scratch and get a feel for actually what people were using it, why were they using it, what were their experiences, and how acceptable these interventions were, bearing in mind that they're not developed specifically for people with severe mental illness. And so there are lots of, this is like my research experience from the Centre for Implementation Science. I've done a lot of work around measures for things like acceptability, feasibility, adoption. So I was involved in developing that repository that has all these different questionnaires for assessing those different implementation outcomes. So we were kind of lucky in a way. We had that sort of starting point to look. But like you say, there's hundreds and thousands of frameworks and outcomes that we could have focused on. But yeah, that was what we went for in the end.
Thank you so much, Zani. And I think you're right. It's a real process, isn't it, in those early stages to really rigorously challenge why a framework could be relevant and how it could be applied, and really using the expertise of the people within the project to really think about actually how it could be used through the study. And you quite rightly acknowledged two key people who are in the room with us, and Ray and Ellie. I obviously welcome any reflections you have on, or any additional comments you have to anything Zani shared there, based on your experiences in the chat, of course, or otherwise sharing with us off mic. But I think it's so helpful to think a bit about that, you know, for anyone that may be thinking about maybe doing more research in this area. Actually learning from the process that you went through, I think, is really key. And I know in some of our write-up we do explore some of that, and of course there are things we can share. I just want to kind of come into the chat here. Roger has really helpfully shared a comment about perhaps one way for the future is to link the data collected with initiatives like Beth, which is of course a platform used within SLAM, My Treasure Chest or similar, used by Merseyside Trust and other trusts over the country. Roger, just to kind of come to your comment there, I think it's really interesting to think about interoperability and integration of devices and how we actually use them within services. It's a really interesting point, and I know it's layered with complexity because of the fact that, you know, many of the various devices and systems are so different and they don't interface so easily. But I think it's really interesting about the linkage of data that you're describing, and how that can help us inform patient care. I think it's a really interesting point. And I don't know if anybody on the panel has any reflections on that point that Roger said there, any comments on that point. That's okay.
Was it something that came up in the results at all, Kathy?
It was absolutely something that came up in the results. So in really all of the stages, something that people really valued and really appreciated was that ability to share the data that was coming up on their phone or their Fitbit with clinical staff, and sort of maybe get a bit of feedback on that and sort of help in what direction to move forward with, you know, whatever their target behavior was. And I think, Roger, you're absolutely right. It is looking at initiatives of how to link all that. And as Gracie said, it's a really complex one, as there's so many different devices out there. But what was also interesting is a couple of devices came up in the study. So for example, I know a couple of GP practices have made their own sort of interfaces and apps which people can, you know, upload any data or chat to their GP, things like that. But at the minute, the reflections on it was still missing that sort of interaction between service user and care team. So like the ability to share data still wasn't quite there. So for example, people maybe were getting results of blood tests or blood pressure, but they weren't getting maybe any explanation of this. And that is something that people are really, really, really keen for. So your point is so valid, and a lot of people are really calling out for the same, but it's a very complex thing, and I couldn't say I would know the way forward, but I know I don't want to put Ray on the spot, but I know Ray has done a bit of work with Beth, so I don't know if you would have any reflections on that, Ray.
My signal isn't great. I'm not sure whether you can hear me or not.
Yeah, we can hear you, Ray.
Okay, thanks, Kathy, for not putting me on the spot, but putting me on the spot. Interestingly, one of the early reasons of looking at this as well was because, yes, our team was involved in some of the physical health development on Beth, and one of our kind of phases of delivery was going to be integration of an app. But which one to choose? You know, which one would people find most useful? Which one would be the one that would be worth following up on? So right back at you, Kathy. I know with the results of the study, you have been liaising with the colleagues at the trust as well, haven't you? So I don't, like, what are their feelings with it now? And am I right in thinking that they have actually gone forward with integration of an app as well? They've managed to choose one or already, but
I think they have chosen an app, but I'm not entirely sure which one it is. But I think, just reflecting on what Roger said and, you know, the results that have come from the study, I think possibly the way forward is maybe not integrating one app, but rather some way to include that real broad variety of devices that people are already using. And as I say, I absolutely don't know the answer for that, but that would be the hope in the future.
Thank you, Kathy. Thanks, Ray. Roger, that was a great question. I think it certainly sparked a little bit of debate from our side, which is exactly what this is all about. I think it's really interesting to just reflect a bit, Kathy, with you on the results. I know Zani was kind of probing a little bit there about them, and I'm keen if there's any reflections you have maybe for the group about any challenges that people really faced in terms of accessing multiple devices and having, you know, the opportunity to access so many devices. You commented on the fact that there are so many apps and devices available, and how, as a service user, do you sort of navigate which ones are best to use? And there was a sort of inference that people kind of use and test and try, and that's really personal, isn't it? The fact that some people think, well, that one's not really for me, and try something new. And I just sort of wondered on your reflections about that, just really kind of what we can learn from that, from the things that people find potentially as barriers to accessing devices, and what that tells us about how we use them and support service users to access them moving forward.
Yeah, I think, as you said, Gracie, there is an aspect of trial and error to it, because different people are looking for different things in their chosen devices. But what a lot of people mentioned was that maybe their sort of interest in devices started off with someone recommending one. And maybe if that specific device wasn't for them, it still sort of sparked that interest to find out what else is out there and find one that maybe suits them the best. But again, just from the results, there was a real call for some form of recommended devices, or not even recommended, just some sort of list or guide as to what is actually out there. Because I think, and I'm sure everyone's aware, that there is just so much out there, and it's very overwhelming for anyone to try and find something that works, something that has all the features they're looking for. So I think that's sort of something we're trying to approach with this popular apps list. And it's not necessarily that we're recommending them to say, this is the best one for step counting, this is the best one for calorie tracking. We're just trying to say, here's a starting point. This is what other service users have liked using in the past. And from there, people quite often find that that can put them onto other devices and just sort of get the ball rolling. So I think for a lot of people, it's just finding that starting point and then moving from there, if that makes sense.
Yeah, it's really helpful, isn't it? And I think Ellie's picked up a good point on this as well, and actually about the challenge of actually recommending apps, not least as clinicians, but as services. That's you know, a tricky thing to navigate. I think it's a really good point, Ellie, you put in the chat there, and something about also, I think we're also really keen, of course, for service users to be informed and led in the choices that they can make, you know, in the care that they want to receive and the things that can support them. So I think things as you describe about the popular devices list is hopefully a really useful tool to enable people to get a sense of what's most frequently used and how people have accessed it, and how helpful it has been. And just to kind of come, I know we're kind of coming to time on the Q&A, but to a comment that Faith has added in the chat here for us, just asking about whether we had any contact with carers or family with regards to their experience of improvement that they may have seen in their loved ones potentially using devices or apps to manage well-being. And I know, Lana and Catherine, you've been so much involved from your perspective and imparting your experiences, but I just kind of want to, if I can, put that question over to you both, just in as much as the involvement of carers. I know the kind of input and involvement of that has been varied through this study, but just what your reflections are on that, maybe for this work or even future work, looking at this kind of use of devices to support people with SMI, what your reflections are on Faith's question there.
I'll go first, Catherine.
Thank you, Lana.
With regards to carers, a lot of carers have actually stated that it's good to see their family members or children or engaged with something in order for them to focus on something else. So it has helped in quite a few households where the service user, their parents have noticed that they're engaged in something else and they're able to talk about something else as well, which will take their mind off possibly what's going on, and in order for them to, I don't know, be a bit more motivated in engaging with something else. So it does work, but you know, it does depend on the individual as well, and if they're willing to share it with their family as well.
Thank you, Lana. Catherine, would you add anything to that?
I think it's good if service users recommend, but I think it would be good to get it professionally organized too. Yeah. I think it's important to, I mean, at the moment, it is service users passing on information to each other. So they know a little bit about their health and well-being, so they understand what is best. But I just think it would be good to get it finalized.
So a more professionally coordinated approach to looking at devices and apps and how.
Yeah, like a therapist could look at it and think, you know, is this useful?
Yeah. And I think it's such an interesting point, isn't it? Because there's a sense of pace with technology and how do we keep up with the varying technologies and devices and apps that are being generated, some of which are very, they have huge impact when they're first launched and then they're no longer available. And there's something in the sort of sustainability of use that's really tricky, actually, in terms of kind of identifying really good apps and devices to recommend. And I know that there's a few that do exist that are obviously evidence-based, that are involved with clinicians actually co-developing apps to recommend, which I think is a really interesting area in and of itself. But I think it's so helpful to think with yourselves, Lana, Catherine, about family involvement. Lana, you said just there a moment ago about actually whether individuals feel comfortable to share with family members. And I think that's a really crucial point, isn't it? Because if you're sort of individually using something, it's hard to gauge if it's having an impact or making a difference. But I think that there is something about the use of family involvement to support use of apps and devices, if that's going to be a part of kind of onward care. I think it's really, really interesting. And I'm so aware that our Q&A has really come to time. Just a huge thank you to those questions that have come through on the chat. And there's another one there from Roger, which just about sort of technical problems resulting from devices. And I don't know, Kathy, if you just want to take this last question, perhaps before we bring the Q&A to a close, just if there were any sort of issues there that come up through the results and findings that you want to comment on.
Absolutely. And I just want to add quickly to the answer to Faith's question there, that it was actually quite interesting that a lot of our participants reported back in the interviews that they had sort of maybe noticed the tangible changes to their physical health or maybe mood from their family or peers saying stuff to them like, oh, you're maybe looking very well, or another huge thing was a lot of these devices maybe incorporate sharing, so sort of online networks where you can maybe, for example, I don't know if anyone has ever used Strava, you can give kudos to people, you can say well done to people, so that was a huge aspect of encouragement, and people's family were noticing the changes. So just to say, that was noted a lot in the interviews, but it wasn't actually from the family and carers, it was from our service user participants. But it would absolutely be an avenue that would be worth looking at in the future. So thank you for that question. And sorry, then on to Roger's question. And the answer in short is yes, Roger. So there was a range of sort of practical difficulties that people noted about using devices, and it was just, you know, all the real ones you'd expect. So a lot of these devices, they've not got great battery power, so people sort of noted that maybe if they forgot to charge them and went out to go about their day, they weren't actually getting accurate data. So occasionally people found that that could be slightly demotivating. They'd sort of get that sense of, oh, what's the point then if my device isn't recording my steps or something like that. Another example was people noted higher error rates and crashing. So people sort of just reflected that there were those challenges there, but people also noted that they didn't have the expectation that a device would be absolutely perfect and would never be faulty. They took that into account, that it might happen. Hoped it didn't, but took it into account that it can happen, and unfortunately that is the nature of technology. And in terms of the latter part of your question about support with that, it really differed between the devices. So a lot of maybe the more sophisticated apps would have maybe built-in support bots as such, so little chat features where you can report any issues and hopefully they'll be able to help you out with that. But some of the more simplistic apps wouldn't really have that. There's usually a number, an email you can contact, but again, I think how useful this was to people really differed from device to device. So it's hard to give sort of a concrete answer to encompass all devices, but for the most part, there was some form of support there. And yeah, I hope that answers your question.
Thank you so much, Kathy. Really succinct summary of two really kind of thorough parts of the study and answering Faith and Roger's questions there. Thank you so very much. We are obviously now going to bring this Q&A to a close. So I just want to say to the panel, huge thank you. Are there any final reflections or comments from any of you before we bring the Q&A now to a close? Catherine, yes, of course.
I think more studies need to be done around mental and physical health and apps, maybe thinking more about physical health, because we've just looked at mental health mainly on this with diabetes, and that's the most common. So yeah, I'm hoping that there'll be more of these studies so they become commonplace.
Thank you, Catherine. I think we absolutely echo that thinking, and that's why kind of moments like this are so important, I think, for us to share and debate and to see where the other gaps are. So it's so helpful. Thank you so much for that final thought. Lana, Kathy, anything finally from yourselves there? No, Lana, thank you. That's perfect.
Nothing to add, but just to thank everyone again for coming along and asking such interesting and important questions. And just to say again to Roger that we are able to share the slides and also are able to share the outputs of our study if that is something you would be interested in. I think that question just went slightly missing at the end there. But apart from that, thank you all for getting involved in the Q&A, and thank you all for listening.
Thank you so much, Kathy. And really now we are aiming to bring this webinar to a close. As ever, the hours just absolutely fly by, and I'm sure we could keep going on this topic. But it's been just so fantastic to have you be a part of it and to hear about this work. An hour really isn't long enough for us to share everything with you. So thank you for your patience and your attention and for all the good questions that you asked us. I suppose really just very finally, on behalf of everyone, I just want to share a few key things with you. As I mentioned at the very beginning, this is the third in a series that we're delivering as the IMPHS team. And on the screen here in front of you, you can see we've delivered 2 other webinars before this one today, and we have 3 more coming up in the new year. If you're interested in seeing those that we've delivered before today, we've got them all up on our website. And of course, we will be sharing round, as Kathy rightly said, the slides and recording from today with everyone that has joined us, and as well for those that weren't able to join us live on the day, it will be on our socials and other areas as well for you to be able to see in playback. And if you'd like to join us for our future webinars, we will be in touch about how you can register for those that'll be coming up in the new year as well. So very finally, I should say, of course, just an enormous thank you. As I'm sure you've gauged from us how grateful we are really for everyone's input and involvement. It makes really what we do such a great pleasure, because we're able to work with people that are hugely passionate in the same way that we are, wanting to make a difference in some small way to the way that service users receive and access our services across the NHS. And for us, it's really important to kind of keep building the community of practice and to keep sharing with everybody that may be interested in this work. So on the screen, of course, are ways you can get in touch with us. We really encourage you to do that beyond today. Of course, if there's any questions that went amiss that you really wanted to speak more with us about, we're very happy to make the time to connect and share with you. And of course, the work of our funders, we thank them enormously for their continued support, the Maudsley charity, who in addition, alongside us, really trying to champion conversations about physical and mental health and ways we can improve that for the future. So all that I'm left now to say is thank you for your time and attention. Our webinar now, of course, has come to an end today. So I leave you now to the rest of your day, and thank you ever so much for your time. It was lovely to see you all.
Thank you.